Topic under discussion today is dexamethasone and remdesivir, their mechanism of action mainly in COVID patient. How the COVID patients are treated with these two medications. Let's just discuss from the very first one, that is dexamethasone. Now we know this point very well. The dexamethasone is actually having two sort of actions. Number one, anti-inflammatory. Number two, it is used as immunosuppressive. Okay, it is actually suppressing the immune system. Immunosuppressants, anti-inflammatory, both are the mechanism of actions. Let's discuss the very first one, how it is acting as anti-inflammatory. Well, before moving towards the mechanism of action, we must know that here we have a cell membrane on which the phospholipase A2 is supposed to have a reaction. This is phospholipase A2 enzyme. Now when this interacts with this membrane, from this phospholipids, it will synthesize arachidonic acid. This arachidonic acid is a substrate for two enzymes. Number one, COX-1, COX-2, COX enzymes. Number two, for the LOX. Here we got COX-1, COX-2 types. Okay, those both two are responsible to interact with arachidonic acid. Now this COX-1, COX-2 will interact with arachidonic acid and will produce prostanoids and thromboxans. Several types of prostaglandins are synthesized along with thromboxans. Now from all those, some very important functions like pain, fever, inflammation are actually controlled by the prostaglandins of special types. And here this LOX enzyme, when this interacts with arachidonic acid, is responsible to synthesize leukotrienes A4, B4, C4, D4 and E4. All these are the leukotrienes synthesized after when LOX interacts with arachidonic acid. Simple. Now what is the function of these leukotrienes? They've got very important functions. Like they're supposed to constrict the bronchus. Along with that, they are supposed to stimulate the eosinophils to release more interleukins plus protease. Now, these interleukins are responsible to constrict the bronchioles, and protease is responsible to damage the tissues. So now here two important functions are seen. Number one, bronchioles are constricted. Number two, tissues are damaged. And as we know, in the COVID patient, the very disturbing mechanism is breathing. So for that, in order to facilitate the breathing of that COVID patient, if we indicate dexamethasone, it will inhibit this phospholipase A2 enzyme. When phospholipase A2 is inhibited, what is going to see then? Very simple, the entire pathway is blocked. At the end, we can suggest that bronchioles are dilated and there is no further tissue damage. So we actually helped by means of these dexamethasones the COVID patient. His bronchioles are dilated and his tissues are no more damaged. That's it. The very simple understanding. Now let's move towards the immunosuppressive mechanism of action. We know when there is COVID patient of very worse condition, in that actually the cytokine storm is actually seen. Storm of actually cytokines is observed. So in order to suppress that immune action, what we are doing is we're indicating dexamethasone. Now this dexamethasone is actually supposed to cross the lipid bilayer membrane of the immune cells like dendritic cells, monocyte, macrophages. So when this crosses that immune cells, then inside the immune cells, glucocorticoid receptor is waiting for this dexamethasone, then that is actually further internalizing this dexamethasone into the nucleus, where it is now going to interact with the genes. Now these genes of immune cells are actually suppressed. When the genes are suppressed, deactivated, inactivated, then the immune system is actually inactive. Now suppressed. So care must be taken while using the dexamethasone. You must not use this in early stage of the COVID patient. If you are using in the early stage, you are suppressing the immune system. So if the immune system in the early stage is suppressed, then the COVID is actually having a chance to have a very easy fight on that patient, and the patient will become very easily disturbed and serious in a very short period of time. So please, please, please do not indicate dexamethasone randomly. Care must be taken while using dexamethasone. Hope you got the concepts of the anti-inflammatory and anti-immunosuppressive mechanisms. Now let's come towards the remdesivir, how it is going to have interaction. Very simple. First of all, let's know that how the COVID is entering into the type 2 pneumocystis. Here we got coronavirus. With its spikes, it will bind to the ACE2 receptor of the type 2 pneumocytes, then it will be internalized, endocytosis will be done. Now here, this will release its RNA in the cell, type 2 pneumocytes. Now this RNA has got a way towards ribosomes, where it is translated to synthesize multiple proteins. One of the proteins, RNA dependent RNA polymerase, which is responsible to read viral RNA. Now this viral RNA, when it is going to be read, this will synthesize copies here of this virus. In the meanwhile, now these copies, when these are synthesized, here exon is waiting for this. This is actually viral exonuclease enzyme. Now this enzyme is responsible to proofread this viral synthesis, viral RNA synthesis. Now what happens if here is a kind of change available in this RNA synthesis? Now that change will be proofread by this particular exon. Now what will happen then there will be a kind of very exact copy synthesized because of this exon. So when there is proofreading, so something will be actually synthesized in a very perfect manner. So like this, perfect copies are synthesized of the RNA with the proteins and some other stuff. Now all these will combine together and they will be moving towards the Golgi bodies. There it will be packed, then released from this particular cell, and then again they will be ready to go find the next receptor of the type 2 pneumocytes and interact with that receptor and damage the entire cells again. Like that, it is continuing its cycle. Now what remdesivir does is very interesting. It has got two important sites and mechanism of actions regarding to research studies. Number one, it is called as adenosine analog. It is just like the adenine of the virus. So now we know this point very well, that adenine, cytosine, guanine, and uracil, when they are chaining up together, they're responsible to form the RNA. So now during this chain-up mechanism, when the RNA-dependent RNA polymerase is reading, so what happens, the remdesivir comes and it replaces, you can say, somehow, it replaces or gets the place in advance of the adenine. So here we have two adenine of the virus, I hope it's visible there. And here we have adenine, that is actually the remdesivir. I'm encircling this. So now these both are actually responsible to come and bind to the remaining nucleotides to complete the RNA synthesis. Now what this remdesivir does is it actually occupies the place of this adenosine, because these both are actually having the same structure like. But remdesivir is the inactive structure, one can say that it is the inactive structure of the viral adenosine because it is analog, analog. So now when this analog is interacting with the rest of the nucleosides like nitrogenous bases like adenine, cytosine, guanine, and uracil. So now if this is incorporated into those remaining means nucleotides, when they're chaining up together, so they will synthesize a new type of viral RNA, which will be inactive. According to some studies, it is suggested that this adenosine, when it displaces that particular viral adenosine, so this is actually terminating the entire chain. So there won't be any RNA synthesis then. And both the studies are actually accepted. So whatsoever the cases, whether it is synthesizing the RNA or terminating the RNA. So if it is terminating the RNA, cases close here. And if it is synthesizing the RNA, here we have the exon waiting for this. Now this exon is responsible to proofread exonuclease. Okay, this is supposed to proofread now this newly synthesized RNA, newly synthesized viral RNA. So now if this is proofreading, so it will find a new type of adenosine which is not the part of the viral RNA. So it is supposed to split this particular adenosine here and to make the new one or to resynthesize the new RNA. So what will happen then? I told you in the beginning, according to research studies, remdesivir has got important functions. Number one, it is analog. Number two, it is supposed to have inhibitory action on the exon. exonuclease is actually inhibited also. So if the exonuclease is inhibited and it is analog, so like this inactive RNAs will be synthesized, and those inactive RNAs are not more functional. So like this, we actually inhibited the synthesis of active viruses. So this is somehow remdesivir is showing the mechanism of action to have a kind of help to the COVID patient. Hope you got. Thank you for watching.